So, students, today we will discuss about the oropharyngeal cancer. I am already going on for the head and neck, and we finished the head injury. We finished the congenital anomalies of the face like cleft palate, cleft lip, and today we will discuss the oropharyngeal cancer. That is the cancer of the tongue, cancer of the buccal cavity, cancer of the tonsils, and cancer of the lips. And all the oropharyngeal cancer we will discuss in common or in this headings, that is oropharyngeal cancer. Introduction. The oropharyngeal cancer, it is the incidence is very less in Western country. It is only 2 to 4%, but in India it covers about 40% of all the cancers in the head and neck. So how much incidences are increased in our country and in our Asian country or in our Indian continents, that subcontinents, that there are people are using the metals, people are using the penny, people are also using the spirits and other things, that is carcinogenic substances, so that incidences in our country or in our subcontinent is 40% of all the malignant conditions in the male. And so the epidemiological factors in India is very high due to the fact that the people of India used to tobacco, smoking, spirits and alcohol and other cancerous cancerous substances. These cancerous substances are as alcohol, that is the common factors that change. If you are taking the alcohol frequently, that cause change of the mucosa of the buccal cavity and even the tongue and other mucosa of the buccal cavity, that cause the metamorphosis and that lead to the cancer transformation. Further is the smoking, that smoking is also, that is the chain smoker usually suffer from the carcinoma of the buccal cavity, either maybe tongue or maybe the lips. The other is the tobacco, that tobacco used to put underneath of the lower lip, and that is anti-cancerous, that is the cancerous substances and cause cancer of Indian people due to the tobacco chewing. The Palmer syndrome is the another condition in which the risk of oral cancer, the oropharyngeal cancer is increased. And also the areca nut, that is the kasali and pan masala, these are the very common things that are used by the Indian populations, and for that purpose the incidences in India, in our country, they are more and more, that 40%, and poor nutrition is the other factor that may cause also the transformation of the mucous membrane of the buccal cavity into the cancerous or precancerous conditions. We should know about the anatomical consultation of the oral cavity and oropharyngeal anatomy. That is the oral cavity that contains the buccal cavity, and it starts from the mammalian border of the lips and goes up to the attachment or the junction or attachment of the soft palate, and also it covers the posterior pharyngeal wall, lateral pharyngeal wall, buccal cavity, and the tonsillar fossa, anterior tonsillar fossa, posterior tonsillar fossa, and also the tonsils and the posterior 1/3 of the tongue, that is the incisive foramen that divides the tongue into the two parts, the anterior 2/3 and posterior 1/3 junction, that is also both the parts of the tongue is very probable for the oropharyngeal cancer, but the incidences are very high in the anterior 2/3 of the tongue and also in the lips. Now if you will examine, that is examine the types of cancer in the oropharyngeal cancer, that is squamous cell carcinoma, that is SSC, squamous cell carcinoma that cause most of the cancer in the buccal cavity is of, if you will examine under the microscope, that will lead to the squamous cell carcinoma. But sometimes some mucus or a small glands like salivary glands, some mucus glands, that may also transform to carcinoma, and then it may be not squamous cell carcinoma, but maybe glandular carcinoma, or the other is the tongue is the most common site, that is the margins of the tongue is very more prone to develop into carcinoma, and that because it is very mobile part and remain under injury and constant irritation to the tongue, and that causes the cancer of the tongue in the margin of the tongue. So the incidences in the tip of the tongue and margin of the tongue is very high in the case of the tongue, and these are all squamous cell carcinoma. The risk factors of our precancerous conditions of the oral cancer, that oropharyngeal cancers, that you can divide into or you can say also the precancerous condition. You can also divide into the three groups, that is the high risk, middle risk, and low risk. The high risk is the erythroplakia. Erythroplakia, what is erythroplakia? Erythroplakia is the reddish or pink color. That the bright pink color of the mucosa membrane of the buccal cavity is called erythroplakia. It is irregular in shape and it is different from the normal mucosa, and it occurs due to the constant irritation or the constant contact with the carcinogenic substances like alcohol, a smokes tobacco, and TB syndrome, and this erythroplakia is very sensitive and may transform into the cancer of the oral cavity. Another is a speckle erythroplakia. Speckle erythroplakia is the condition in which there is patchy red spots on the leukoplakia. Leukoplakia is the white fibrous bands into the mucous membrane of the buccal cavity, and in between the leukoplakia, that is in between the white patch, there will be erythroplakia, that is the pink color, bright pink colors or points in the leukoplakic patch, and that is called a speckle erythroplakia. A speckle erythroplakia being a scattered bright red coloration into the leukoplakic patch, and this is called a speckle erythroplakia. That is chronic hyperplastic candidiasis. That is, candidiasis is more common in case of the buccal cavity, and this fungus infects the oral cavity and the mucous membrane of the tongue tip and the cheeks also, and also the angle of the mouth. And this chronic hyperplastic candidiasis is also can transmit, if it is not treated in proper times, then it can be transferred into the oropharyngeal cancers and lead to the cancer formation into the tip of tongue or into the angle of the mouth or into the lips also. The immediate risk factors are the oral submucous fibrosis. Oral submucous fibrosis is the condition in which there is fibrosis underneath of the mucous membrane of the buccal cavity, and due to the fibrosis underneath of the mucous membrane, there is constriction or there is constriction of the mucous membrane, and also the buccal cavity patient is unable to open the mouth clearly, and there is little opening, or the opening of the mouth is restricted, and it mostly occurs in the Indian race, and due to the taking of high alcohol, smoking, tobacco, and TB syndrome, this oral submucous fibrosis takes place due to the smoking or other and other carcinogenic substances that lead to the fibrosis underneath of the mucous membrane, and then the restriction of the movement of the tongue as well as the mouth, and there is little opening of the mouth. Patient cannot open the mouth openly, and there will be difficulty in chewing, speaking, and other condition, and more or less, if you are not treating the submucous fibrosis in time, then it will transform into the oropharyngeal or cancer of the mucous membrane of the oral cavity. The another one is the syphilitic infection. Syphilis is the condition in which it affects in secondary and primary, secondary and tertiary stages. In case of the tertiary stages, that is in syphilis, or in case of even secondary stages, there is ulcers are there, and these ulcers or gummatous lesion heals by fibrosis, and this syphilitic infection is not treated properly, there will be healing of the lesion by fibrosis, and this fibrosis is called leukoplakia, and this leukoplakia is the precancerous condition, and sooner or later, if you are not treating properly, then this syphilitic chronic infection will lead to the formation of the oropharyngeal cancer. The another is the pseudophilic dysphagia, is the condition in which there is iron deficiency without anemia, and this pseudophilic dysplasia, there is the smoothness, the smoothness of the mucosa of the buccal cavity, the roughness of the buccal, that is glands of the mucous membrane, electrified and called shining smooth surface of the buccal cavity and the mucous membrane of the tongue, and this is due to the atrophy of the glands and the mucous membrane that will transfer. If you are not treating the pseudophilic dysplasia, sooner or later will develop into the oropharyngeal cancer. The low risk factors are oral lichen planus. Planus is a condition in which you are not treating properly, and then cause the oropharyngeal transformation into the oral cancer. It is called lymphomatosis, the another condition also in the buccal cavity, that in chronic condition cause transformation in the oropharyngeal cancers. So these are the three risk factors. You can divide into three groups: high risk factor, middle risk factor, and low risk factor. High risk factor is erythropedia, spectral erythropedia, chronic hyperplastic candidiasis, and middle risk is the oral submucous fibrosis, syphilitic infections, pseudophilic dysplasia. And in the low risk factors are the oral lichen planus and discoid lymphoma. That another what are the clinical features? In pre-malignant condition, you also in clinical feature you should also think of the pre-malignant lesion, which will give the information that this lesion is going to be transformed into the cancer, and this pre-malignant condition is the leukoplakia. Leukoplakia is the white speckle fibrosis in the mucous membrane of the buccal cavity, and it is cannot be explained etymologically or physiologically. This leukoplakia is due to the fibrosis due to the mucous membrane, due to infections like chronic irritation, like the chronic ulcers of different organs, that heals by the white patches, or even the fungal infection, chronic fungal infection or candidiasis can also heals by white patches, that is called leukoplakia. This leukoplakia sometimes it may be either a small spot like a smooth and well circumscribed, but may be also very discrete and very large one, and it is different from the normal mucous membrane. And this leukoplakia is of pre-malignant cancer of the vessels of the cancer formation. The aspical leukoplakia is the condition in which in the erythroplakia, that is the pink red mucosa, that is fibrosis, is aspical white patches and so many places, and this is called aspical leukoplakia, that is the scattered white patches into the erythroplakia or into the mucous membrane of the buccal cavity is called aspical leukoplakia. And this leukoplakia also is pre-malignant condition. If there is aspical leukoplakia, you can think about, if it is not treated in proper time, and you can think about the transformation into the oropharyngeal cancer. The erythroplakia I have already mentioned in the high risk, that the erythroplakia, that is the bright red pink coloration of the mucous membrane of the buccal cavity. It is due to the some infection or due to the change of the pattern of the cells, nature of the cells, that with plagia, with the other chronic irritation or with the alcohol or with the smoking or with the tobacco, that there is bright red coloration of the mucous membrane of the buccal cavity, and this is called erythroplakia. Erythroplakia, when it is big speckled leukoplakia, it is more malignant, and so when all these lesions occurs into the mouth, either maybe white patches or maybe red pink patches or maybe a speckled leukoplakia or a speckled erythroplakia, then you can think about the cancer conditions of the buccal cavity going to be transferred into the buccal cavity. So these are the pre-malignant lesions of the oropharyngeal cancer. Other clinical feature, the pain is not usually occurs in the beginning of the cancer of the oropharyngeal, and it may be chronic ulcer or in the mouth that may appear as the chronic ulcer or a speckled leukoplakia, and in this way, if it remains for a long time, it remains painless, and only when you will eat or when there is contact of the pre-cancerous condition with the alcohol or a smoker or spices, that cause burning sensation in the mouth, and there may be ulcer that will not heal even for the 6 months. Then you can think about the malignant condition of the ulcer. There may be swelling of the buccal cavity, or maybe swelling into the mandible or in the jaw, that also manifests as the oropharyngeal cancers. And if there is swelling in the neck, also due to the metastasis in the lymphatic metastasis that appears as presentation, maybe due to the swelling in the neck, and this is due to the fact that this swelling of the neck is the secondary deposits of the malignant condition of the oropharyngeal cancers. And so the another clinical features, pain only occurs in the later stage of the oropharyngeal cancer, because pain occurs when it invades the perineural invasion, or when there is arterial invasion of the cancer cells that may cause either bleeding or may cause pain, and pain may be otolgia, that is pain in the ear, and occurs due to the permeation of the cancerous cell into the nerve endings, and that may cause pain into the ear. So these are the clinical features, and there may be swelling, and there may also be difficulty in deglutition and difficulty in swelling, and there may be dribbling of saliva for all the times from the angle of the mouth. These are the clinical features of the oropharyngeal cancers. Now, how can you think about the potentiality for the malignancy? Suppose these are the pre-malignant lesions, and how can you say that these are going to be, suppose there is ulcer for more than 6 months in the tongue or in the buccal cavity, how can you know that it is going to be transformed into the malignant condition? So you should know when the age of the ulcer, that is the ulcer is not healing for the more than 6 months, then you can think about the cancer transformation. When the age of the patient is more than 60 years, then any ulcer or any buccal cavity difficulties can transform into the malignant condition, and in denture or artificial denture that cause chronic irritation of the buccal cavity, that may lead also to the transformation. If it remains for the more than 6 months, then you can think about the cancer formation. Smoking and alcohol taking, that is, if there is just smoking for chain smokers and the habitual drinker, always get malignant changes, and if there is any malignant changes refuse to heal without prevention of disease, but it has been seen that when you will stop the taking alcohol, or if you will stop the smoking, or if you will stop the tobacco, the incidences of the cancerous formation of the premalignant lesions is minimized. That becomes less, and you can think about the so when you cause preventions and abstinence from the alcohol and smoking, tobacco and palmalism symptoms. So these are the conditions by which you can know that the lesion is going to be transformed into the malignant condition. The classifications of the oropharyngeal cancers, TNM classification is the important one, and this TNM classification, the T stands for the tumor site, N stands for the lymph node, and M stands for the metastasis. T is very important, that is the tumor size of the tumor. You can divide the tumor into the 5 or 6, 7 groups, that is T0. T0 means there is no possessible cancer cell. That Tx means they are not negotiable cancer cells, and TIS means carcinoma in situ. So you T can be divided into the T0, T X, T IS, T2, T3. These are the 1, 2, 3, 4, 5. TS, T1, T2, T3, and T4. These are the classification of the tumor, that is size of the tumor. If size of the tumor in T1, there is no accessible tumors or no swelling, nothing else. TH, no cancer cells are there, and TS, that is carcinoma in situ, is there, but no transformation into the tumor cells, and no cancerous cells can be found. T1, when the ulcer is less than 2 centimeter, that is the less than 2 centimeter, that is called T1 staging of the tumor size of the tumor, and when size of the tumor between the 2 to 4, that is the T2 classification, and when it is 4 to 6, it is T3, and when more than 6, that is it is T4. So these are the conditions in which you can categorize the tumor size of the tumor. You can categorize into the T0, TX, TF, IS, and T1, T2, T3, T4. And in case of the node, that is the N, that is lymph node. So lymph node is T is the tumor size, the N is the node, IM is the metastasis. So N is the, you can also give it the T0, N0 means no lymph node is palpable, and NX, that is no accessible, T0 no accessible lymph node, NX means the lymph node is not palpable, TIS means that IS means lymph node is not, that is carcinoma in situ. But T1, when the lymph node is less than 3 centimeters in size, in the neck or in the submandibular luea or in the deep cervical lymph node, T1 is the condition in the ipsilateral side of the nodes, and this node is T1. T2 is the between 3 centimeter to 6 centimeter, and T3 is the more than 6 centimeter, 3 to 6 centimeter, and T4 above this 6 centimeter. And so you can categorize the lymph node as the T N0, NX, NIS, N1, N2, N3. They similar to that, the M means metastasis, M0 it can be categorized into the 2 groups, that is M0 is the condition in which not accessible, don't give node or no metastasis, no incidences of metastasis. And M1, that means the metastasis that takes place in the submandibular gland, and most commonly the metastasis of the oropharyngeal cancer takes place in the submandibular gland and also into the deep cervical glands, that is the upper cervical, mid cervical and lower cervical glands, and also sometimes into the posterior and the neck lymph node is also involved in case of the distant metastasis, and then the metastasis can take place in the other organ also. So these are the condition in which you can classify. The classification, that is the clinical classification, you can also do a stage 1, a stage 2, a stage 3 and a stage 4. A stage 1 include, that is the T1, a stage 1, T2, a stage 3, T3, a stage 3, T4, a stage 4. And N0 you can categorize and combine with the TNM classification by clinical methods and by the CT scans also, and then TNM classification is known for the purpose of treatment and prognosis of the disease. So today just this is all about today, but we should revise or we should sum up whole of the session, that is the in oropharyngeal cancer. Oropharyngeal cancer is common in our country. More incidences are of course in our country than the western country, because we are taking more cancerous substances, that is the alcohol or the cancerous factors, the alcohol, smoking, tobacco, BB syndrome, areca nut, pan masala and poor nutrition. These are the risk factors by which the cancer of the carcinogenic substances that cause contact with the mucous membrane of the buccal cavity and transformation of the buccal cavity and change of the mucosal pattern and lead to the oropharyngeal cancer. The anatomical consideration, you should also know the buccal cavity and oropharynx, and it is mostly a squamous cell carcinoma, and then the risk factors can be divided into the three groups: high risk, middle group and middle risk and low risk. All these erythroplakia, specalohypoplastic candidiasis, which included in high risk, middle risk, that is the oral submucous fibrosis, septic infection and cytopenic dysphagia. These are the conditions that included in the risk factor. The low risk factors are the oral lichen planus and desquamate lymph nodes, and these low risk, these are the risk factors of the formation of the oropharyngeal cancer. That pre-malignant lesion of the cancer, when you are asked sometimes what are the pre-malignant conditions, then you should discuss about the leukoplakia and atypical leukoplakia, erythroplakia, and also the chronic hyperplastic candidiasis. These are the pre-malignant lesions of the mouth which are going to be transferred into the oropharyngeal cancer if it is not treated in proper way. The how can you know that the precancerous lesion is going to be transferred into the malignant condition? So when the early ulcer that doesn't heal within 6 months, then you can think about the transformation into oral cancer when the age of the patient is higher, that is more than 60 years. Then you can think also about the if there is a smoking and other alcohol imbiber or tobacco chewing persons that also cause malignant condition. The classification I already mentioned just now. So this is all about today. Thank you. In my next class we will discuss about the treatment, investigation and treatment plan of the oropharyngeal cancer. Thank you.